Hi everybody, welcome to Dynamic Alignment Bodywork. I'm at my studio here in Capitol Hill in Seattle, which I'm sure at least some of you recognize. And I'm on a few minute break in between clients, and I wanted to shoot a video talking about nerve entrapment, particularly around the feet. So I've got mine out, and I'll show you I guess what I mean and then what you can do about it in a moment. This video was spurred on by someone writing me with a question saying she had pain in her foot, which didn't seem to be spurred on by any particular injury that she knew of, and it felt really sensitive in certain kinds of movements, but then she wouldn't notice it at all in others. So for her it was pain on the top of the foot, towards the inside of the ankle, like kind of along this big toe line, and not sensitive anywhere else, or really when she was walking. And it sounded to me like, among other things that could be going on, it could be a kind of nerve entrapment issue. And I sort of found this in myself after I started running quite a bit a couple years ago, which I don't do anymore, actually, every once in a while. But when I was running a lot, every once in a while I would get this pain on the inside of my ankle here. And it would be kind of debilitating, and then where I could walk, but I would be limping on it, and then it would just go away mysteriously. And as I've learned more about the kind of work that I'm doing now and the tissues that I'm working with, I think a lot of times in my experience there's a nerve entrapment issue. So we have our connective tissue system, all of our soft tissue systems. So you think muscles, tendons, ligaments, if you're familiar with the term fascia. Fascia very much a part of that too, our body's all-pervasive, three-dimensional connective tissue web. As part of that, your arteries, your veins are pretty enmeshed in that fascial web, as well as nerve tissue. And ideally, everything is gliding pretty well. And I make this motion, though this is pretty overt. It's much more the movement of like nerve tissue within the fascial tissue is pretty subtle, but they're both able to ideally glide a little bit and move and stretch, and some areas will be much more mobile than others. And what's important isn't to know necessarily what's supposed to be more mobile or not, unless you choose to do this for a profession, but that everything's gliding as it should, and your body knows how to do that, until it doesn't. And a lot of times, as we all know, we get that information because something hurts. So back full circle to that sort of foot pain, and I would preface this with what you might imagine being the usual caveats of if there's a lot of pain, if it's accompanied by some sort of traumatic injury or a lot of bruising or swelling, take care of yourself, right? Go see a physical therapist, a doctor, someone like me who may well refer you out to somebody else, maybe to get an x-ray or an MRI, certainly if it's some sort of trauma. That said, if there's kind of a mysterious feeling pain without any particular redness or swelling or bruising or trauma that you know of, here's a technique that you can try on your own. And the nice thing about bodywork is that at worst, often it just feels good. Right? And at best, maybe we can actually really help clear up some nerve entrapment issues. So, I'm going to tilt this down. So maybe you can see me on the table. Perfect. So, we have our foot. Here, the foot and ankle, right? And there are, as you might imagine, along with this soft tissue and the musculature here, there's nerves embedded sort of within that muscle tissue, and certainly outside of it as we drop down towards the heel, towards this bony landmark here. Ideally, we want the heel, the calcaneus bone, to be pretty mobile on its own. That means if I hold the rest of the foot, I actually get a little bit of wiggle. This can sort of be hard to feel on yourself. You can rest it on a table, which is a little bit out of my view, but turning those muscles off will help me feel what sort of wiggle room I can get. And I can certainly do this with a partner too. But what you can do is, with your own hand, um, I am just encouraging a little bit of glide around these areas. So what I mean by that is taking my fingers and pushing in just deep to the skin. So I don't have enough pressure to like push something down if I was holding it, but it's also not like just resting a feather on top, right? There's enough, if this is just the layer of skin, I'm pushing a little bit deep to that, but not right to the center of my tibia. So here, right around the heel, I'm going to push in with, I'm not really great with pounds of pressure, but maybe 10? That'd be my guess. Enough to, maybe enough where you'd start to crack an egg. That'd be good. So not eggshell, but a little bit more than that. And I'm going to just start moving. I'll bring this in a little bit. Just start moving along my heel while I flex and extend. I can rotate either way. And I'm just moving my foot a little bit. And the visual you can have, and what I want to encourage here is getting that nerve tissue, which is what I can engage if I push down just a little bit, especially at these bony areas. Right here I'm getting all sorts of stuff. But down at my foot and heel, I'm going to engage that, and then I'm gliding the bones underneath it, really lightly. So again, and I'll belabor this point, I'm not smashing down and doing a lot of range of motion type stuff really fast. It's pretty like I'm tacking, I'm just doing a little bit of movement. Err on the side of lighter for almost all of us. I can go up the other way. Again, this can be hard to do on myself, but you can certainly give it a try. And if you have a friend that can help you along with this, that's perfect. If my fingers slip, you can dunk your hands in a little bit of water, essentially like a water-based lubricant. You can even lick your fingers. And you just want a little bit of like tack. So I'm not sliding, but I'm not putting oil on my fingers either. That's great for muscular work, but not so good for what we want to do right now. So I can do that on the inside. I can do the same thing. This might be a little bit harder to show. But same thing on the outside of the foot, where I want it relaxed, right? I'm not holding my leg up. And I can engage that nerve tissue, that sort of superficial fascia, which obviously only goes so deep because the bone is underneath it right here. And I'm just lifting and doing a little bit of movement. And I know I've really been emphasizing subtle up until this point, and sort of like soft. And that said, once you sort of get a feel for it, you can start to get in there a little bit more. I'm not smashing, but I can really see how things are gliding. I can cut my whole heel, pull a little bit of traction apart. Here's the movement of my hands. Here, while I'm engaging on this side, as well as the outside. And try this for about 5 minutes, which will probably feel like a long time in, giving yourself your own foot massage sort of world. And then stand up and walk around, and if it feels, notice the question I often ask, does it feel the same, worse, better? Not looking for any particular answer, but if you start to feel on the track of like, okay, that actually feels a little bit better, awesome. You might want to go back and like play around a little bit more, especially if there felt like a particularly potent spot you were working with. And again, almost always, at worst, it'll feel the same, and you just gave yourself sort of a weird kind of foot massage for the last 5 minutes. And certainly, and this would be part of that larger caveat, if you stand up and you're definitely not helping yourself by working on it, that's a great time to just stop. Again, and go seek professional help as you need. But again, hopefully that kind of body work that you can do on yourself, that you can do with a friend, can be pretty simple, and sometimes can really, really help quickly alleviate nerve pain, nervy type pain that can persist for a long time. And if you just hit it in the right way, it might not clear up the systemic issue, so to speak, as to why that happened in the first place. And it can be a really nice and really effective self-remedy tool and sort of party trick. Anyway, I hope that helps, and see you all soon.